Hello, I'm Dr. Mabrie. In this video, I'd like to discuss non-surgical options for revision rhinoplasty using fillers. The goal for most rhinoplasties is to make the nose more attractive, and this is achieved by creating a smooth contour of the nasal bridge, ending in a defined and proportionate nasal tip. This can be accomplished non-surgically using fillers, a gel-like substance that are placed under the skin with a needle, and they're used to shape and contour the nose. And they can be used to shape and contour the nasal tip, making it smaller and more defined. Non-surgically, you can augment the nasal bridge using fillers to make it longer, more narrow, and more defined. In revision rhinoplasties, we have a different set of challenges. There are some patients who simply don't want more surgery. There are some patients who need a great deal of structure and contour. And then there are some who've had a pretty good surgical result but need a small change. And this can be just as challenging surgically as the big changes. And finally, I'm going to show that there are some patients who've had a surgical rhinoplasty that have some roundness, and it appears that they need to have their tip reduced in size, but they actually could use more support, structure, and contour. So our first case is a patient who was pretty unhappy with their first rhinoplasty and really didn't want any more surgery. She had this dip above her nasal tip seen on profile, and we were able to treat her in our office by placing some fillers there. And we did that avoiding a trip to the operating room, and everybody was happy. This case is a little more challenging. She had a great loss of support, a lot of irregularity of her nasal bridge, and the tip was neither proportionate nor defined. So we were able to build this up, give a great contour of the nasal bridge, and you'll see that the tip actually looks smaller and more defined than it did previously. This would have been very challenging to do surgically and would have required another trip to the operating room and several months of recovery. And this is a patient that I operated on, and we were both really happy with the profile view. We augmented her bridge and made the tip more proportionate and defined. On frontal view, we were happy with the nasal tip, which was smaller and more defined than before surgery, but now that the tip was smaller, she started to notice a bump on the left side of her nose. We looked closely and we saw that yes, this bump had been there before the surgery, but now that her tip was smaller, the bump was more obvious. And in fact, the bump was really caused by this slight concavity that she had on her nasal bridge. And so we treated this by adding some filler to that concavity. And in this way, we were able to, again, create a bridge with a smooth contour that ended in a defined and proportionate nasal tip. And we were able to change a good rhinoplasty result into a great result. And this final case I want to show is a woman who also had multiple rhinoplasties and left her with an irregular contour of her nasal bridge and a round and undefined nasal tip. Now, I did treat her surgically for the nasal bridge, but for the tip, we actually used fillers to add some definition and make it more proportionate with the nasal bridge. And how long do these fillers last? They last for a total of a year, but at 6-month intervals is when most patients come for a touch-up. So this is a man who before had a downward slope and curve of his nose. We used the fillers to change that curve and make it slightly upturned. And this is him 6 months later, where he has lost some of the fillers, you can see that, but he still is better than when he started. So when he comes back at 6 months, we use some of the filler to maintain his results, and we take the extra filler and we place that wherever he wants, under his eyes and his cheeks, lips, etc. So in summary, non-surgical techniques are an excellent choice for revision rhinoplasty. We use fillers to contour the shape of the nose. The procedures are done in about 15 minutes in the office, and patients return at 6-month intervals. I hope the video was helpful, and good luck in your search for information.